and he has a very clear understanding on how substances such as these affect your kidneys, among other things. That's his background, nephrologist. And then essentially we also have Special Agent Charles Buffalino. Give him a round of applause.
Some of our colleagues have outlined this. If you can look at the slide, I only have 4 slides, so I'll be brief. Traditionally, THC is what is the most commonly used marijuana substance naturally. And we can see here that it has mainly CNS brain effects, and baby blue material is where THC is uptaken by your receptors. Now, here's the problem. The synthetic components of the new drugs produced overseas have taken, and there's 60 different cannabinoids, okay, 60 different. THC is the most common, so there's 59 other variations, naturally. Now, the synthetics have taken advantage of that, the different cannabinoids, and they have made them up to 300 times more potent agonists with more potent side effects. So imagine these little bubbles here multiplied by 300. So what you're getting is a hawk effect. Now, that's just, it was first introduced in 2004. I published the first paper on this in 2011. A patient almost died, 19-year-old who overdosed by using a hookah. And it was all over the news channels, and that's where my passion began. But the problem is that with agonizing these receptors, the cannabinoids, CB receptors, you can go all the way wherever you want. There's CB1 and CB2. We don't need to get into the science, but the reason why these drug dealers are successful is A, they have a vendor, internet, and easily outsource. B, they're cheap. C, they are sold as safe because everyone's talking about marijuana being legalized and this won't come out in your urine. This is the free or legal form of it. And now, to further add to these receptors, so if you can imagine 300 times more, that's why we're getting kidney failures, patients that are going insane, coming into the hospital doing crazy things. That 2 million high school students are using these through vaping, not just synthetic drugs. I'm just saying vaping, and I think that's where this gets crazy. But to answer your question, essentially they have mimicked the cannabinoid receptor that was naturally occurring in THC, and they've gone as much as 300 times the potency of traditional puff of marijuana.
Thank you. How about from a medical perspective? Why is vaping synthetic drugs more dangerous and more addictive?
So I think to answer this question, I have to bring a little epidemiology into it. A lot of the expert panel here have so far talked about the problems of vaping, and even in the hospital, Broward Health, we have patients in their bed vaping. They don't even go to the bathrooms. I've had in residency patients smoking joints in the bathroom and the alarm goes off, and that happens at any county hospital, I'm sure, or any hospital. But now, they're just vaping in their beds. It doesn't matter. They're walking around. They're going downstairs. So to add to this, the vaping has produced a mechanism of ease, of efficiency, and also ease of mind that you can do it at school, and you can do it in the bathroom. I've seen tons of people on I-95, and I'm sure the police officers here have as well, just vaping away while they're driving, whereas before cigarettes were cumbersome, and you'd have to deal with the smell and everyone looking at you and coughing around you. So I think that's why they're dangerous, and that from 2011 to 2014, 13.4% of high schoolers in the United States have tried in the last month vaping. And hookah is another form of vaping, but just bigger form. You know, it's something Middle Eastern traditionally, but it's hit here before the e-cigarettes. That's 9.4. And look at the dramatic decline, which we should be celebrating about smoking cigarettes and cigars. But this is transacting into this. So this cigarette smoking is now going to vaping. So, and I think our pulmonologist in a few minutes will also attest to this, but this is the beginning of a very dangerous, now put drugs on top of this is just vaping. And you have something that is not only going to cause car accidents and crime, but you have something that is going to burn our future youth's brains, our neighborhoods, our community. And just to mention, 1,000+ Fahrenheit is the temperature of an average big puff through a vape. Okay, whereas cigarettes are 300 to 600, depending if they're slim or, so 1,000 degrees is what you're putting in. And they're doing it all day long. Not just one puff, 30, 50-minute break, another cigarette. They're just from 8 a.m. till 3 p.m. or 10 p.m. Just non-stop overdose. So before I answer that, and I'm almost done, can I just allude to this online website that I just got this morning out of 150,000 hits for buying K2 Spice or vaping synthetic marijuana? Lovely lady with the 800 number available, $32.95, shipped directly abroad. All credit cards are accepted, FedEx and UPS delivery. Now, once we get through this hump, let's get through the medicine of it. We know that marijuana, and I'm young at this, but my father's also a physician, and I've talked to some of the ICU intensivists and pulmonary physicians and other physicians who have been doing this longer. Marijuana had its problems through asthma, lung cancer, chronic smokers, just like anything. And yes, some will have psychogenic effects, but this was not a big ER burden. Cocaine was, heroin was, other drugs were. But what we see now, and some of the things I've outlined, is essentially, if you can remember that picture of the CB receptors and the little dots all over your body, you multiply that by 300 and you get profound side effects. So probably THC has a little tiny bit on your kidneys and a little bit on your immune system, but it goes away. But when it's 300 times amplified, it's going to have an effect. And this was the very first case published, and I think this is when I had a bout of 7 patients who I started dialysis on at Broward Health, not only North Broward, Imperial, and Broward General. Marijuana. I said, well, the 7th one, I just couldn't take it. I said, liver failure, kidney failure. I basically went up to this young lawyer who was a law student at UM, and I said, what are you doing to yourself? You know, this, and he says, I bought this at Marathon. I said, what do you mean Marathon? He says, oh, and it was Scooby Snacks. Had a picture of Scooby-Doo and had a big tongue and all this stuff, and it says, not for human consumption. Not for human, and I forgot the slide there, but there's over 150 different Cloud9, Pineapple Express, Happy Bob. Anyways, long story short, this patient almost died. It was on the news media, blood red eye, his eyes almost popped out, bloody eyes, with tears. He was on dialysis, he almost lost his lung. He was 19 years old. He did about 10 bags of that Scooby snack on a hookah back in 2010 because he had a job application and he knew that it wouldn't be positive. He bought that from Oakland Marathon, over the counter. That's when Sunrise was the first state to ban it. So to answer your question, kidney failure, heart attacks, death, lung failure, cancer, and you name it. But most importantly, and what scares me is like what we've seen with Flocka, is crime. Picking up a gun and going crazy, going to a store, you can name it. But the psychotic, and if you have underlying bipolar or depression, and some people have genetic propensities, you better believe that this is going to amplify it. So at the very end, just please do not forget that this is the basis of the danger ahead, is the efficacy on these receptors. Thank you.